How does bone conduction work in an audiometry hearing test? Imagine being able to test your hearing without using traditional headphones. That's exactly what bone conduction does during an audiometry test. Instead of sound traveling through the air into your ear canal, it travels through your bones. This method helps audiologists understand how well your inner ear, or cochlea, is working. During the test, a small device called a bone oscillator is placed on a bony part of your skull. The most common spot is behind the ear on the mastoid process, but sometimes it's placed on the forehead. The device converts electrical signals into tiny vibrations. These vibrations then travel through the bones of your skull directly to your inner ear. Because of this, the eardrum and middle ear bones are bypassed entirely. As the vibrations reach the cochlea, they stimulate the hair cells inside, which send signals to your brain that you interpret as sound. The audiologist then plays pure tones at different pitches and loudness levels through the bone oscillator. You're asked to indicate when you hear each sound. The softest sound you can detect at each frequency is recorded as your bone conduction threshold. This information is compared to what you hear through air conduction, which involves sound traveling through the outer ear, eardrum, and middle ear before reaching the cochlea. By comparing these two results, audiologists can determine the type of hearing loss you might have. If your bone conduction thresholds are normal but your air conduction thresholds are worse, it suggests a conductive hearing loss, which means there could be a problem in the outer or middle ear. If both thresholds are similarly reduced, it points to sensorineural hearing loss, which involves the cochlea or auditory nerve. When there's a difference between the two, called an air-bone gap, it indicates a mixed or conductive component. Sometimes, masking noise is used in the other ear during the test to make sure that ear isn't detecting vibrations from the test ear. This ensures the results are accurate for the specific ear being tested. Bone conduction testing is especially helpful for diagnosing types of hearing loss that involve the outer or middle ear, or when traditional earphones can't be used. It provides a direct look at how well your cochlea is functioning, independent of other parts of the ear. This makes it a vital part of a comprehensive hearing assessment. Always remember, if you have concerns about hearing, it's best to consult a healthcare professional who can interpret your results and recommend appropriate treatment options based on your individual needs.